Welcome, and thank you for joining me for this important episode of Society Chat. As colorectal surgeons, we know firsthand the physical and emotional impact we endure on a daily basis. A major focus of my presidency has been increasing awareness regarding surgeon wellness. This encompasses two major categories of well-being. During the November episode of Society Chat, we examined the psychological aspects with Dr. Tracy Hull, who discussed second victim syndrome. Today, we are going to discuss the physical impact of being a surgeon. Here with us today to discuss surgeon injury and ergonomics in the OR is Dr. Anna Spivak. Dr. Spivak is a staff surgeon at Cleveland Clinic, Ohio. She has developed an expertise in this area. Dr. Spivak, it's a pleasure to have you here, and we welcome to Society Chat.
Thank you for having me. It's a pleasure to be here and talk about this very important topic that affects all of us.
So how common are operating-related injuries for surgeons?
Well, they are incredibly common and probably underreported. And I just queried, it's also widely published on and gaining momentum and popularity in the last couple of years, have been around obviously for many, many years, but just out of curiosity, queried PubMed, and just in 2023 alone, it was 1,800 papers that's been published about ergonomics in some capacity. When we talk about the ergonomics, it's ACS reports that 7 out of 10 surgeons will have either a musculoskeletal injury or pain during their career. And most of it is attributed to our ergonomics, or at least it's something that we can fix, and that's why we are talking about it. The injuries also reported significantly higher in women surgeons, and that's related to sort of extra burden ergonomic challenges. And just to kind of throw some numbers at you, so the neck injuries are reported at 55%, shoulders 52%, back 59%, upper extremity 39%, and that's from the publication from the Female Pelvic Reconstruction Surgery on Review and Ergonomics from 2018, and they note themselves that all of these injuries are underreported.
So that's quite an array of injuries, anywhere, across the entire, body. What are the typical sort of mechanisms and patterns that lead to these injuries?
Well, the easiest one to explain and I think to understand would be actually cervical injury, because it's very simple. It's an increased surgical load, which can be just positioning of the head in the operating room. So the natural posture is under 15%, and 15% is not a lot at all. So most of us operate anywhere between 30 and 45, at least proportion of the case. The headlamp can increase that cervical load even more. And what happens is that it leads to this increased cervical load, leads to the chronic degenerative disc disorder, therefore cervical radiculopathy, chronic pain. And if it is caught at the point where it is still reversible, whether it's massage, physical therapy, improved posture, it could be reversible. But unfortunately, if it gets to the point where it is at the point already of cervical radiculopathy and chronic pain, most times there's not much that can be done about it, even after the surgery. That's may shorten career of a surgeon and certainly contribute to not just a shortening of a career, but also dissatisfaction with the job and even burnout. We also can talk about repetitive motions, whether it's hands, which can lead to tendinitis, trigger finger, carpal tunnel, and then therefore in the long run, arthritis. More eye injuries or eye-related disorders are seen with increased use of robotics or laparoscopy, because essentially it's increased screen time in some capacity in a very concentrated, sort of hyper-concentrated fashion. And we don't even think about it, right? We do spend 10, 12 hours in the operating room and then go do more computer work. So that's many, many hours of screen time. The feet is standing, plantar fasciitis, that's familiar to many. So all in all, anything you touch, whether it's neck, shoulders, back, elbows, it's a combination of posture, static, just inability, not moving, static motion, incorrect positioning, and sort of unnatural positioning in the operating room, which we often find ourselves because we're so hyper concentrated in the case. It's all about the patient, and we just kind of getting it done.
Wow, I mean, it's with all with the chronicity and how long these these injuries are with us. Why do so many surgeons never seek treatment for them?
I think it's very, this is probably a question that takes, years and years back, because we're trained not to complain, right? We are trained to kind of get the job done. It's all about the patient. How many of us take a day off work because, you have a minor cold, or, some don't feel quite well. So if you have a, sort of a regular job, oftentimes people take off and they take a sick day. We come in, and because we have other commitment, we're committed to our patients. So I think it goes along the same way, right? You finish your surgery, pop in an A leave, and move on to another day, and then it becomes a chronic thing. And I think that this is something that's a culture, and it's something that we should continue to change, and hopefully prolong our careers, as well as increase job satisfaction with not having that chronic pain.
So how did you become interested in the ergonomics of surgery?
So I'm 5 feet tall. I'm sitting, so you can't tell, but I'm very short, and I have 5.5 size hands. So most of the things in the operating room are not made for my size. So I found myself pretty early on, right, not just in multiple step stools, but using 2 hands for the stapler. So kind of using accommodations to just get it done. I'm also in my past taking it back to my childhood. I was a competitive athlete, and I was very much used to sort of, if you don't have pain at the end of the day, you didn't train enough, right? So the concept of pain was very familiar. So it's like, oh, it's normal, right? You have pain at the end of the day. But there came a point, and that's actually happened when I completed my training, right? You kind of start thinking about, what am I doing? What am I doing right? What am I doing wrong? And that was the point for me where I realized, like, okay, so I have to look at my surroundings, become more aware. And the way I think about ergonomics, it's, the first and foremost is awareness, self-awareness. What am I doing wrong? Why am I having, what can I do better? What should I change in order not to have these, whether it's pain at the end of the day, or whether it's just kind of muscle spasticity. And then using correct ergonomic principles, and that is education, right? So kind of self-education, making sure that, and we'll talk a little bit about it, but talking, making sure that I follow correct ergonomic principles so that my motion in the operating room is optimized. The other thing that's very important in ergonomics, and that's something that I'm sort of very interested about and been a little bit involved into, getting more involved into, is industry advocacy, is not just optimizing the instruments for our use, but also optimizing the way we use the instruments. So kind of both. And then, self-care. So that's how I view it. And that's what interested me about it. And, starting with education and self-awareness, for me, that was it.
So outside of the OR, before you get there, from a preventative standpoint, what's your routine? What things do you do to sort of set yourself up for success, so to speak?
So I think that's, something that resonated with me, that maybe I read, maybe I heard from somebody, maybe it was in the talk, where, we can talk about surgery being like we're essentially athletes, right? And we need to train for like athletes, and we also need to recover like athletes. So I think, it all starts with getting good night's sleep, being mentally prepared, eating breakfast in the morning, making sure that, all the equipment, whether it's the right staplers, the table, whether it's the monitor heights, whether it's if it's a colonoscopy day. For example, I use the knob adjusters for colonoscopy because my hand is small, so that helps me scope with one hand. So all is there for me, right? So that everything is in order, and that's usually kind of how I start and make sure the day is successful.
Well, and now that you're in the operating room, what things do you do to arrange your operating room to, set the table, set positioning, whatever sort of things that you need to sort of have a good, long, comfortable day?
So I'm actually going to go back to what I mentioned. So ACS published their ergonomics recommendations. So I'm going to go kind of down the list there, and that's pretty much exactly what I would do. So, starting the day, like I said, we make sure we come with everything prepared, but then in the operating room, so the table height, right? So it has to be to the tallest surgeon in the room. So as much as I like to control the height of the table, I make sure that whoever is across from me, right, it could be a fellow who's 6 feet tall, it's going to be to his height, because I can stand on 2 step stools. He cannot make a hole in the floor, right? So make sure the table height is appropriate so that the angle between the arm and the elbow is 90 degrees, and it's comfortable for everybody. That instrument screens, everything is set up at that we can operate at the neutral posture, so we don't have to reach for things. Kind of using the box principle that is well described. So the wrist is straight, elbows at 90 degrees, arms do not have to go across the midline, do not have to avoid wrist reaching, avoid range of motion, kind of using the body support when appropriate, avoiding the static posture in the operating room, avoiding the situation when it has to be sort of exaggerated kyphosis, right? Again, we're going back to non-physiologic condition, and avoiding the increased cervical load whenever possible. Even weight distribution, right? So you talk about whether it needs to be a step stool or anti-fatigue mat, so making sure that is comfortably set up. And then if it is, endoscopy day, right, making sure that all the monitor and bed again is at the appropriate height. Mentioned I use a knob adjuster. And then on robotic days, it's very important, right, to make sure that the ergonomics of the console and the chair are set up. So again, chair height, making sure feet are flat on the floor, decrease the lumbar load, so the wheels have to be locked, because if the wheels are not locked, we're controlling the kind of the rolling motion with the feet, so that that increases the strain of the lumbar spine. I don't use lumbar support, but some people do. They put like a special cushion on the chair, making sure armrests are appropriate. So the arms are in less than 90 degrees, making sure the console height is at the appropriate height. And one thing that I found is that if somebody else sits at my console and they readjust the settings, sometimes the save button is hit, so that needs to be readjusted all the time. And of course, again, that the console is tilted appropriately, so the cervical load is again not increased. And I always make sure that if I'm operating with a fellow, that they are set up the right way. So we usually do the little check-in before the case, like, hey, this is what you're gonna do, and like this looks good. And I have some pictures in my phone of the fellows where I've taken a picture, like, this is really bad, like this is not how you should sit, readjust it. Let's see why it's wrong, because it's it starts early, starts with the training of getting the right habits, and that's how we set up for success.
Or maybe we should start adding ergonomic timeouts to our
ergonomic times off. That's excellent. I that kind of informally do that, but essentially there's people who advocate for doing an ergonomic time off. And another thing that I didn't mention, but sometimes make a point of it. Oftentimes it happens kind of naturally, is doing tiny micro breaks, right? So we're talking about like stretching, changing position, making sure that we are not in the same, static position through the entire case.
So if a surgeon does develop an operating related injury, what should they do about it? Who should they see? What's your advice?
I think the key is to see somebody, right? So whether it's starting out with PM&R physician or starting out with physical therapist, usually somebody needs to refer to physical therapy. If it's a hand injury or neck injury, seeing an orthopedic surgeon, and or PM&R if appropriate, right? Start at some point somewhere to get diagnosis and treatment before it becomes a chronic injury and irreversible and leads to the end of the career.
So just to sort of wrap things up here, what simple advice or simple preventative measures or health activities can you give us and all the other surgeons out there to, what can we do how do we best prevent these injuries?
Well, I think the biggest thing that we need to focus on is continuing to change the culture and continuing to talk about it, being very aware of potential injury, being aware of the ergonomic principles and following the ergonomic principles, teaching the principles to our trainees, right? All the things that we talked about, they're well described, right? Making sure that all those principles are followed and optimized, doing the ergonomics, timeout, doing the micro breaks, again, teaching the right techniques to the trainees. I think continuing, industry advocacy, whatever position people are, surgeons are in. So whether it's, at the hospital system level to get the right instruments, or whether it's, with industry themselves to redesign the instruments, and then again, optimizing our use of them. I think self-care is incredibly important in what we do. So we haven't touched base on that yet, but right, the recovery. So making sure that we get sleep, that we get proper exercise. So some kind of combination of stretching and strength, but conditioning our bodies to be able to withhold those, fairly robust and fairly demanding needs of the operating room. So just staying strong and staying healthy for what we do. I think that's a huge preventative measure that we need to remember to do, and that's can't emphasize it enough. And simple things like hand strength training, right? So not just the ergonomics or economy of motions, but also keeping the hands strong and keeping and giving them time to recover. That's important. And always remembering the good shoes. I think that's a very, very important. So anti-fatigue mat is great, but if your shoes don't have proper support, that probably will lead to problems later on. So that's also, for me, self-care. So I think those are just a few things to remember in everyday life and everyday practice.
Well, thank you. This was incredibly informative, and I think this is an incredibly important topic. And I want to thank you for joining us in this important episode of Society Chat. And I look forward to seeing all of you at next month.
It was a pleasure, and thank you very much for having me.
Thank you for watching, and remember, this is your specialty, and ASCRS is your society. You are part of this legacy of surgeons who have made our specialty what it is today. See you next time.